It's really simple because everything in our body from our head to toe relies on amino acids for rebuilding, right? So whether it's your enzymes, whether it's your hair, your skin, your bones, your hormones, all those things kind of boil down to needing amino acids, especially your neurotransmitters in your brain. And so we'll use serotonin as an example. So serotonin is like our happy sunshine neurotransmitter. And when that is working correctly, life looks really good. Your glass is more than half full. It's not half empty. When you're empty of serotonin, you kind of feel like Eeyore. You're anxious, you're depressed, you have OCD. It leads to all sorts of other mental health issues. And so when that is functioning well, then you feel good. And so amino acid therapy comes in with therapeutic doses of, we'll say, L-tryptophan or 5-HTP to rebuild the serotonin levels in your brain. You add a few cofactors in there, and that will lift that depression. That'll lift that anxiety.
Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live wholly. Ready to explore what's possible and be truly healthy?
Truly MD podcast. I am Dr. Monica Jauregui, and if you are looking for a more holistic approach to mental health, then you should listen in today. We are going to talk to a functional nutritionist who is going to talk to us about her innovative approach to how to deal with depression and anxiety in a more holistic way. So welcome, Laurie Hammer. Thanks for being here, Laurie.
Oh my goodness. Thank you. Thank you so much for having me, Monica.
Excellent. Well, I always like to know a little bit more about how people come to do what they're doing, because we all each have a unique path. That's really important to the reason that we came to to be this kind of clinician. So tell us a little bit about what led you to be a functional nutritionist, how you got there, and how it led you to work in mental health.
Yeah, so I had my own health struggles. So it's how many of us start, right? We have our own health struggles, and then we're on the path to how do I fix this? So back, way back when, because I'm 52 now. So when I was a teenager and into my early 20s, I struggled with an eating disorder. So I was bulimic. So I binged and purged a lot and tried to get into some eating disorder clinics. I wasn't low enough weight. I wasn't suicidal enough. I didn't really fit those more extreme parameters. But I was still passing out. I was still having seizures, and I was still binging and purging multiple times a day, and my life was a mess. I was in nursing school at the time when I had a friend. She was actually my nursing professor, and she's like, "We've got to get you help." And she couldn't find me help. So I was doing counseling. I was doing all the therapy stuff. I had said no to medication because I just knew that wasn't the answer, even way back then. But the cycle was still continuing. And so I thought if I moved away, that would take care of everything. Well, it didn't, because, you can't avoid what's going on inside of you. So then she sent me this informational article from a GNC magazine that her husband randomly got about a clinic, an outpatient clinic in Mill Valley, California, that dealt with addictions and eating disorders. And the article was on that when you have these intense craving cycles, that you're actually addictive or you're sensitive or allergic to the things that you're eating. And they talked about amino acid therapy and how they can cut that craving cycle. So I'm like, okay, let's try it. So I called out there. They said, sure, come on out. And I indeed, they tested me, everything that I was binging and purging on, I was sensitive to. So gluten and dairy and all those things. I had celiac disease that I didn't know about before. And so that explained a lot of the gut issues and all sorts of those things going on. And now I know it's a microbiome. But back then it was just you can't eat these foods anymore. And then, adrenal issues, thyroid issues, yeast overgrowth. And then most importantly, I discovered that my body was severely deficient in lots of nutrition, which I didn't know at the time. And they used amino acid therapy to rebuild the neurotransmitters in your brain. And so using targeted therapeutic doses of specific amino acids cut my cravings. Like it just eliminated them. And so I was able to overcome the bulimia, rebuild my brain, and then I was able to actually function normally. I could actually think. So when your brain is depleted, you can't think well. You can't work through things in counseling if you don't have the capacity to process all of that information, right? Or to process any of the trauma that you went through. And then when my brain was feeling better, my body started feeling better. And I realized I didn't have as much, drama and trauma that I needed to work through because I could actually understand what was going on in life and then work through everything that was still left over. And that was my first dive into this crazy functional nutrition, medicine world. And that's how I got started. And it literally, honestly saved my life.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support.
That sounds really, really interesting. So, amino acid therapy, not something that I know of, is something widely understood. So, can you explain a little bit about what that is?
Yeah, it's really simple because everything in our body from our head to toe relies on amino acids for rebuilding, right? So whether it's your enzymes, whether it's your hair, your skin, your bones, your hormones, all those things kind of boil down to needing amino acids, especially your neurotransmitters in your brain. And so we'll use serotonin as an example. So serotonin is like our happy sunshine neurotransmitter, and when that is working correctly, life looks really good. Your glass is more than half full. It's not half empty. When you're empty of serotonin, you kind of feel like Eeyore. You're anxious. You're depressed. You have OCD. It leads to all sorts of other mental health issues. And so when that is functioning well, then you feel good. And so amino acid therapy comes in with therapeutic doses of, we'll say, L-tryptophan or 5-HTP to rebuild the serotonin levels in your brain. You add a few cofactors in there, and that will lift that depression. That'll lift that anxiety if that's the reason why you're depressed in the first place. And then you can work on your gut health. And then you can work on the hormone imbalances. So what's left over after, you balance that brain, that neurotransmitter system going on.
So, as a clinician that is evaluating patients that may benefit from this amino acid therapy, is there any type of testing to tell you which amino acids or which cofactors, or where do you start with these type of patients?
Yeah, so you could do urine testing, you could do blood work, you could do those types of things. I personally use a questionnaire because it's real time. You can use it and it's actually more accurate that I found over the years than urine testing and those types of things. So it's symptom based. So I have it divided into 5 different categories for people to fill out what's going on. And then I send them a kit of amino acids in the mail, and there's 9 different supplements in there that we try. So we'll get on a call like this. So it's a Zoom call. And I actually have patients open up the capsules, put them underneath their tongue, and then we kind of stare at each other awkwardly for a couple minutes. And then what do you notice going on in your brain or your body for that matter? Could be cognitive, could be emotional, could be physical. And so I often hear clients say, my brain feels lighter. I feel like there's sunshine coming into my brain. I feel like this weight has been lifted off my chest. My shoulders don't feel like they're stuck to my ears anymore, or the noise is stopped around me and I can actually be present in this conversation. So things happen really fast, which is the beautiful piece of it. And so when they're done with the appointment, there's already hope there because they like, oh my goodness, that particular supplement helped me feel this way. And then you want more of that. And so then we can rebuild that whole neurotransmitter cascade in your brain and then add the cofactors in so that we know everything's converting well.
Fatigue, brain fog, mood swings, weight gain. If you're a woman in your 40s to 70s, you've probably been told that it's just aging. But what if it's not? At trulyhealthymd.com, we look deeper. Hormones, nervous system health, hidden toxicities. You're not broken. You just need a doctor who really listens. Visit trulyhealthymd.com and book a consultation today. It's time to feel like your real self again.
Wow. It's always interesting when we can have some fast results because
Yes,
a lot of time it's hard for patients because a lot of times the
it
results
takes a
really
while.
are, yeah, it's slow. So in addition to using these amino acids, since you're coming from a functional nutrition standpoint, I imagine that you also work with patients' nutrition, lifestyle. What sort of things do you integrate from that standpoint?
Yeah, so we definitely work on the diet. So we want to make sure we have a good foundation there. So making sure they're not eating, the standard American diet, work on, their macros, getting enough protein, healthy fats, fruit and vegetables and all those kind of things. So just tailor that to the individual person. But then also, working on sleep. Are they getting enough outside time, sunshine, removing toxins in the home and those kind of things. We don't start there because that can be overwhelming, especially when your brain is feeling anxious and depressed.
What age range do you work with? Because I know there's a lot of teenagers that have these
Yeah.
issues. Do you work with teens or is that too young?
Oh, yeah. No, I work with teens. I work with little kids too. So I've even had a few, you know, toddlers and stuff that I've worked with over the years that is very helpful. So amino acids are just the building blocks to proteins. So you do have to navigate some medications depending on what that patient is on. But other than that, it just helps to rebuild things in your body.
Okay. And when you say navigate medications, does that mean that certain people can't do this if they aren't certain medications, or what should people know before considering this?
Yeah, so we'll go back to serotonin. So a lot of people are on SSRIs. And so when you're on an SSRI, you want to make sure that you're using the amino acids, specifically tryptophan and 5-HTP, about 6 hours away from that medication. So it's just navigating timing on all of that.
Okay. So you can take people who are on medications.
I
It's
do
just
all the
the
time.
it's
Yes.
just
And
the
then we
timing.
work with their prescribing doc and then, help them navigate that situation.
Do you have any prescribing docs that are concerned with your therapy? Just because, we've, as a prescriber, we want to avoid serotonin syndrome and those type of
Yes.
things. What kind of conversations do you have with prescribers?
Just, that very thing. Most people don't know about amino acid therapy, but people know about amino acids. And I would say it's very rare that I have a prescriber that's not willing to work with amino acid therapy because it's such an easy thing to do. And there's not a lot of side effects that can go along with it, other than maybe somebody doesn't respond to it or a specific amino acid might give them a little headache. And then, we talk about navigating the medication correctly. And it's very rare that I have a doc that's not on board.
Excellent. That's good
Yeah.
to know.
Isn't it good to know? Yeah, because it's so many other things. They're like, "Oh, my doc tells me no," but I think most doctors in general don't want people on medications unless it's absolutely necessary. So I think their goal, most of them out there, are for people to get the best healing they can.
Absolutely. And so, not that you would ever take somebody off medication that's already on it, but do you see cases where people are less reliant on it? What's the timeline as far as like what somebody would expect if they're coming to you, they're on medication? What do you tell them about that?
Yeah, so most people that come to me don't wanna be on their meds. So the goal most of the time is that we're able to get them off of their medication. So that's probably about 95% of the time that they're able to, wean off their medication correctly with their doctor, and then we bring in the amino acid therapy alongside of that. So it's usually pretty, I wouldn't say easy, right? Because medication withdrawal, getting off medications is never technically easy, but I would say the amino acid therapy minimizes the withdrawal symptoms from those medications.
And then when people get off medication, do they need to stay on these amino acids forever, or is that something that you just kind of get replete to some extent? You could just manage it with lifestyle and nutrition at some point,
Yeah.
or you swap out a pharmaceutical pill for
Yeah.
a
We don't want
non-pharmaceutical.
the swapping, right? We wanna get people to the place where they're just using it as tools, as a boost, like I said, it was in 1996 when I first started using amino acids, and so there's stress in our lives, we'll get depleted, and so it's just learning how to use these to replenish when you need to. Like when my mom died, I took a few of the amino acids for a few weeks because it was hard. The grief process really depletes depletes your brain, depletes your body, right? And so then I would use them to give myself a boost there. So my goal is to teach people how to use them when they need them. And then if you don't need them, you don't need to take them.
Excellent. Are there any patients that you feel like are not the right type of patients to work with you? Somebody that you exclude for XYZ reason?
Not really. I mean, you just have to have the mindset and to give it enough time. The amino acids work quickly. For some people, they don't. I mean, there's always that subset of the population, about 10%, where it just takes longer. Most of the time, people feel really great within 90 days. And, then we can, navigate past that time. But sometimes it just takes longer for people to feel well enough not to use the amino acids or to stick with it long enough to see the results, and that's just a challenge. So if you don't have a lot of patience or you're not willing to work 3 to 6 months, on this, then that's probably not for you.
Okay. And apart from sticking with it, doing the regular visits with you, seeing how the amino acids, how they respond to the amino acids, are there a set of other things that you have people do? Because I know as a prescriber, I always want to make sure that before I prescribe something, I make sure people are going to therapy. They have some way of doing exercise or at least increased movement. What else is in the toolbox to help these patients?
Yeah, we're always talking about movement, food. A lot of my clients are on, they see a therapist. And so I think that's really key in that as well. If that's something you need to do, a lot of people don't. So after they're on the amino acid therapy, they're like, I think I can deal with life now. But yeah, we're always working on making lifestyle, making what are good, trying to navigate rushing women syndrome, I would call it, as my friend Minnie Pell says, because we try to do too much as women. So trying to help people navigate like what's really important in their life. And so we can weed out the things that cause us to be stressed in the first place. And some people need to, dive deeper. I mean, you work a lot with, co-infections and Lyme disease and, all that kind of stuff in the past. So getting people the right kind of help they need is really important as well.
Yeah, absolutely, absolutely. I think people always love hearing about cases, success stories. Is there a certain case? Obviously, we can't name specifics. We can't divulge that, but without naming too many specifics, is there a certain case that stands out in your mind as something that you're like, hey, this is somebody that had a great result, kind of how they started, what their progression was, just so that our listeners can kind of wrap their brain around what it would look like when somebody
Yeah.
sees you.
Yeah. So one that comes to mind is she's mid 30s, and she came to me on 5 different medications. So we'll talk a little bit about, a success story with the medications. And her goal was to get off her meds. She'd been on and off a lot of meds since she was 12, but those 5 medications for like 10 years. She had a great prescribing physician. And so I was able to work, through all that with her. And we're 10 months out, and she came to me and she was very depressed, very anxious. Um, a lot of OCD issues, didn't like to leave her house. She worked from home, so that made it more convenient to stay home. And now she actually just ran a marathon. She's very active. She started dating someone. Like, she'd been single for quite a while. And she's off all 5 of her medications. And
Wow.
and she looks like a completely different person. I just said to her the other day, because her eyes are so bright and she's just got a smile on her face all the time. And she just looks beautiful. She looks like somebody who actually enjoys her life now. And it's just really fun to watch.
That's amazing. That's amazing. A lot of the patients that suffer with depression, anxiety, or at least those that are willing to talk about it, are females, a lot in
Yes.
reproductive ages. Is this something that females that are either pregnant or breastfeeding, something that they can do safely, or do you just need to wait until after pregnancy breastfeeding?
I've had a lot of women over the years use the amino acids because let's just be honest, there's not a lot of studies because we don't study pregnant women and breastfeeding women, with medications and things like that. So I can't say that there's backed by a lot of studies, but I have a lot of women that they're like, well, I could either go on an SSRI or I could use L-tryptophan, which would be better for my baby, right? And just really great outcomes. They're the building blocks of everything in your body, so amino acids are generally pretty safe. Again, if you're pregnant or nursing, you do need to chat with your doctor or your midwife or whoever you're using for that.
Excellent. And I'm sure that you find some cases are a little bit more challenging than others. All us clinicians have cases that you just
Always.
will, great, and others that are just seems like they drag on. Is there something consistent that you found, those that don't have the success that you would have expected? Where does your brain turn to? Like, is there something that you go to routinely to say, okay, let's try this differently, let's try this other path? How do you flesh out those problems?
Yeah, usually it's like a hidden infection of some sort when people don't respond, and it's usually, raising their cortisol up really high, and that just kind of keeps you in that anxious state. So we'll do some testing. I like to use Dutch testing for cortisol and hormone issues. And then if we need to, we can dive into those co-infections, whether it's Epstein-Barr virus or a Lyme or a mold exposure. Those are the things that usually keep people from getting well. I do see a lot of people that have some vaccine injury, especially from, the COVID shots and those kind of things. So I would say that that's a new factor that we hadn't dealt with before, but it really changes your microbiome in your gut. And so we need to work on that again.
Yeah. Oh, yeah. A lot of new things that we're just learning as a medical community. What
Yes.
sort of, since you mentioned the microbiome and the gut, do you do any gut work with patients, any
All the
testing
time.
specifically for that? That's not just um, what kind of testing treatment do you do for the gut?
Yeah. So
Since,
if we need to do
that's
gut,
something we
yeah.
focus in so much in
Yeah.
functional medicine.
Yeah. Because we definitely need to, it's a gut brain connection, right? We got to deal with both of those. And so, yeah, I'll do gut testing, whether it's food sensitivity testing, which can, disrupt your microbiome, or like a gut zoomer, or some other type of functional gut testing. We'll definitely dive into those things. I use a lot of pro, postbiotics, a lot of gut healing protocols. So we're always working on the gut. 'Cause if we can heal the gut and the brain, life gets a whole lot better.
Yeah, absolutely. And that's what I've seen in my practice too, that if the gut's not addressed, it's kind of hard to, or it's impossible to heal the brain. And so as optimistic as I would want somebody to be when they're doing amino acid therapy, I wouldn't want them to ignore that part as far
Never.
as like, hey, we can do the amino acids, but let's not forget that we have to address gut and
Yeah.
the other things,
And,
hormones and
and my thought, Monica, is, this is what I've seen, and when you calm the nervous system down, when you calm the brain, when you nourish the brain, then the gut heals better and faster. So if we can calm all of that down, then your gut has the opportunity to heal a little bit deeper.
yeah, absolutely, absolutely. I deal with a lot of people who struggle for a long time healing their body, and
Hmm.
they've done everything right. They're
Yeah.
on the right nutrition, taking the right supplements, but until I get them into structured limbic retraining,
Yes.
that is really what finally helps them make significant progress. And so, yeah, healing the brain can heal the body also. So, gut-brain
Yes,
connection
absolutely. I
goes
love
both.
limbic retraining. That's amazing therapy.
Yes,
Yeah.
absolutely. Is there a specific limbic retraining program that your patients have had more success with? Because I always hear about different ones coming out, and I always refer people to them, but it's, I never get a consistent response as to which one's
I
the
don't
best.
either. I've have clients try lots of different ones and mixed results depending on, which one, but I haven't seen one that works way better than another one or one that just doesn't work. So I think it just depends on what's the best fit for the client.
Yeah, yeah, that's what I found too, but I always like to run that by
I
other
know it's
people.
always such a good question. I wish I had one that was like, this works all the time, but I don't have that.
Yeah, it would be great if we knew there was just like one thing that always worked,
One
but
thing. There's
unfortunately,
never one thing, is it? Nothing.
no, there never is. Absolutely. Um, Yeah, that's a lot of really, really hopeful information for people that are struggling with depression and anxiety because that's just one of the main issues that we deal with as a society, especially with all our kids growing up and just being more on social media. They
Yeah.
kind of have replaced that social connection. They think they're connected, but they're not really. Do you have any specific advice as far as using screens, gadgets, social connection? What sort of direction do you give to patients in that sense?
Yeah. It's so hard for teens, right? Because that's how they're connected. So we start with nighttime, if at all possible, to, shut those devices off. We start with 30 minutes, then we work to an hour. And then if we can get the teens to leave it alone for like 2 hours before bedtime, we see much better results with sleep and, just getting in that deep sleep. So we have that reparative mode. Adults seem to be a little more willing. Not get in on your phone for at least 30 minutes after you wake up. Go outside first, go for a walk, do some exercise before you open up that phone and, face what's coming at you for the day. And then, like myself, I try to not look at my phone like just like 3 different times during the day, morning, noonish, and then nighttime so that you're not stuck on it all the time. So stopping the scrolling, it's a lot easier when your brain is balanced. You're not looking for that dopamine or that endorphin hit. So if we can balance those specific neurotransmitters, you're less likely to want to keep scrolling and get sucked into the deep pit of Facebook or Instagram or TikTok or whatever it might be.
Yeah, yeah, it's hard. It's hard at all ages.
It is.
We kind of say we get onto the teenagers for doing that, but as adults, a lot of us are.
We're always scrolling on stuff, right? And so just disconnecting from that
Mhm.
habit.
Yeah, absolutely. And as you said, these amino acids are building blocks for all proteins, neurotransmitters, not just serotonin, but also melatonin. Do you see people's sleep get better, even if that's not
Yes.
the main thing that you're targeting?
Yes, absolutely. Sleep definitely gets better because we'll use them at night before bed. So, tryptophan, GABA, whatever they need to help them sleep deeper.
Okay. Are there any amino acids that you use in the morning, or are they basically just mostly nighttime therapies?
No, we use them all during the day. So I have a lot of
Okay.
clients that will take them, 2 to 4 times a day because we'll burn through them pretty fast as your body is healing. And so I don't use like tyrosine or DL-phenylalanine or L-phenylalanine at night because those can be a little bit stimulating for some people. So we try to avoid those at night, but they're really great for during the day, for focus. Yeah, depends on the person. Depends on what's going on.
Yeah, that's great. And we all know when we sleep a little bit better, everything else is easier the next
Oh
day.
my goodness, right? If we can just sleep well, like so many things clear up.
Yeah, I know. Next day, you're feeling better, your appetite's
Yeah.
regulated, you're not craving all that junk food that you're not supposed to have. Definitely such a plus when we get people sleeping better, more motivated to do exercise,
Yes.
and then put that exercise in. So it just kind of like starts coming together nicely once we get those things together. Has been a really, really interesting conversation. I love it when we have more tools in our toolbox than just the medications that we know about. A lot of things that people can do for depression, anxiety, but adding this amino acid therapy definitely is a great beacon of hope for a lot of people. So I know we talked about a lot of concepts. If there's just one or two things that you want people to make sure they remember after this conversation, what would those things be?
I would say that there's always hope. So if you feel like you've tried everything, there's other things out there that you can still try. And so I feel like amino acid therapy is one of those things that people miss. We can't medicate away a nutrient deficiency. We actually have to fix the nutrient deficiency. So that's my goal, is to, educate people and to encourage them that it's, we say it's all mental health, but I really think it's a severe nutrient deficiency in why we have the mental health issues that we do in this country.
Yeah. Very, very interesting. Well, thank you so much for being with us, Lori. And we'll make sure to have your website on our show notes so that people can read up on any other information. And we really appreciate it.
Thank you so much for having me. I appreciate all that you do.
Thank you.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feel your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.